Hey everyone, thanks for joining us for Advocacy Week, a time for the American College of Emergency Physicians and the Emergency Medicine Residents Association to empower young physicians and med students to build a better healthcare system. I'm Gus Adkins Murphy, immediate past president of EMRA, and I'm honored to be joined by U.S. Representative Dr. Yadira Caraveo. Pediatrician Yadira Caraveo represents Colorado's 8th Congressional District. She made history by becoming Colorado's first Latina federal representative. She was also the first in her family to earn a college degree. Dr. Caraveo then earned her medical degree at the University of Colorado Health Sciences Center and completed her internship and residency at the University of New Mexico Health Sciences Center. Dr. Caraveo served in the Colorado State Legislature, where she worked to lower costs for all Coloradoans. And now, as a member of Congress, Dr. Caraveo is focused on working to lower costs for families, improve healthcare access, and ensure children have the opportunities they deserve. Dr. Caraveo serves on the House Agricultural Committee, serving as ranking member on the Subcommittee on Commodity Markets, Digital Assets, and Rural Development, and she serves on the House Committee on Science, Space, and Technology. So Dr. Caraveo, thanks and welcome to Advocacy Week.
Well, thank you so much, Dr. Adkins Murphy. It's wonderful to join you and the rest of the residents in the association and to talk to other medical professionals about advocacy and how important it is for doctors to be involved in policy and politics.
Amazing. Well, can you share a little bit about your journey into medicine and how you made the transition from physician to advocate and now to legislator?
Well, I always imagined my journey as being purely in medicine. Apparently, I decided when I was 3 that I wanted to be a doctor and never really varied from that path. My parents are immigrants from Mexico. They came to Colorado in the 70s, and I think my mom would have loved to have been a doctor. But they didn't even have a high school in the town that they grew up in. So from an early age, they really emphasized education. And so I took that seriously, went to med school and residency, as you talked about, and really imagined that my entire life was going to be about serving my community as a physician. I had always been interested in politics. I remember watching presidential inaugurations and being fascinated by that, but I always thought that that would just be kind of a side hobby. And I'd volunteered to canvass for different presidential campaigns and never thought that the two would meld together. Really, the first time that started to come together for me is when I decided to go into pediatrics, which was after my 3rd-year rotations. And I knew that in particular for pediatrics, it's very important for doctors to be involved in advocacy because children can't do that for themselves, right? And they can't vote. And so nobody really takes their interest to heart a lot of times. And so when I started to look at residency programs, I really made sure that I looked at programs that had a strong advocacy program. And that included the University of New Mexico, which the program director at the time was really heavily involved with the American Academy of Pediatrics. And so when I matched there, I knew that advocacy training was going to be automatically a part of what I did, but also something that I was very interested in. It was also a unionized residency program, which is still unusual. There were about 20 to 25 programs at that time that were unionized, and having always been a supporter of unions, I decided to join and then was convinced to run to be a delegate. So I was advocating both for the needs of residents and for our patients, really talking about the different equipment that we needed as residents and what we were seeing as needs for our patients every single day. So when I finished residency and came back to Colorado, I really thought that was going to be my path. I was going to be a pediatrician in clinic all day and then serve on different boards and commissions. So I joined commissions on mental health and the transformation that we knew we needed at the time in Colorado, on early childhood issues to make sure that early childhood education and health and dental health and mental health were all being kind of taken as a whole, and thought that that's what I was going to be doing. But the more that I was in rooms talking about the needs of children, the more I realized that people in government positions I could talk to them until my face turned blue, but they didn't have to listen to me. And so after Donald Trump was elected as president, I got more involved in local politics through a friend, joined the local Democratic Party. And from there was really encouraged to think about running for office. At the time, there was one doctor who was serving in the state legislature. She was termed out, and they wanted another doctor to serve. And so I was asked initially and said, no, I have a real job that's not flexible. There's no way that I can run for office. It actually is said that most women have to be asked about 7 times to run for office. And that's probably the number that I hit before I really started to think, you know, I keep saying that somebody should know the things that we see in clinic every day. Somebody should do something about it. And maybe I should be that somebody. Because I was sick of all of the things that we see that affect children in particular, but all of our patients every day that we can't do anything about as a doctor. So I ran for the state legislature, served there for 4 years, and then this district was created because of an increase in census numbers in Colorado, and having it be in an area where I grew up, where I'd been seeing patients for 10 years, I decided to increase my advocacy and to the federal level, and decided to run for Congress.
Wow, that's amazing. It sounds like kind of a combination of the stars aligning, that it was the right moment, that the community really needed you, but also took a lot of hard work, both from you and so many people around you who believed in you. So that's really, really amazing.
Absolutely,
So
thank you.
now that you've started to, well, not now, but over the past like 3 years, as you've started to take on legislative issues, how do you think your background as a physician has most impacted your advocacy? I would imagine mostly in positive ways, but there are probably also some challenges too.
You know, you'd be surprised at how helpful a medical background and the way that we're trained is in terms of tackling legislation. I mean, I think that we all know that it really changes the way that you look at the world, right? And really, you can trace any issue back just about to an effect on health. You know, that it became very stark to me that we needed more medical expertise in the legislature when, as a freshman legislator, people would come up to me and say, hey, doc, what do you think about this healthcare legislation that's coming through? And I would start to go through the pros and cons of different things. And they'd say, no, just tell me how to vote because I trust you. And really, that's what a lot of legislators have to do. You can't know everything, right? Even as generalists, I think we scratch the surface of a lot of different topics. That's really what a legislator is. So you can't know water law and healthcare legislation and real estate law, et cetera. And so you have to find the people that you trust. And as a doctor, people automatically trust us in a lot of ways, but in particular on healthcare issues, obviously. And so I had an outsized impact even as a freshman on moving votes for or against different topics in the state house that impacted health. But it also really changed gave me a different way of looking at healthcare, at legislation overall. I ran a census bill my first year because a lot of funding for different health programs is based on census numbers, and Colorado didn't have a great plan to prioritize how they were going to count, in particular, undercounted communities in the census. And so I was able to look at that through a different lens. I, very early on started talking about abortion legislation and the fact that we really needed to codify rights into statute and into the Constitution, because I could see the challenges coming that eventually led to the downfall of Roe and the situation that we're in today. And then the way that we think is very unique. The fact that we can take a lot of information, really boil it down to a diagnosis, which you can do kind of with legislation as well, to determine what it is that needs treatment in a way, what the best steps are going to be to write legislation to really take care of what the problem it is that you're seeing, and then be able to communicate with people, which is such a big part of our training and what we do every single day with patients, and take big concepts and boil them down into understandable layman's terms. And so I've really found that my training in medicine has applied very well to legislating. As a pediatrician dealing with kids, you would be surprised at how applicable that is, in particular here in Congress, with the way that people act. And then just the way that we think and we analyze things has been incredibly helpful.
That's amazing. Well, you mentioned several of your key legislative issues, and you've already been really prolific since being elected to the federal level to Congress in 2022. You've co-sponsored bills on a lot of issues that EMRA and ASAP support, addressing rural health disparities, affecting IVF access, studying overpriced pharmaceuticals. So those are just a few, but thinking about the medical students and residents that might be watching this, how could a physician or even a medical student take the hurdles that they face providing patient care and successfully channel that into a bill that could make it to the desk of a legislator like yourself?
You know, every single day that I saw patients, excuse me, every single day that I saw patients, I could come up with a bill concept, right, just from the challenges that I was seeing. Whether it was talking about kids and their ability to get special needs services in schools through IEPs, whether it was issues around housing, because I was seeing a lot of homelessness and just a difficulty for people to pay for rent or stay in their homes, whether it was the availability of free lunches in schools, given that we were seeing a lot of food insecurity before COVID that people didn't realize existed. Really, with every single patient, you can find something that needs a fix legislatively. And a big part of that, and a big part of what drove me to run for office was dealing with issues with pharmaceuticals and insurance companies. I think we've all been in the position of talking to somebody with a checklist that needs a physician-to-physician authorization for treatment. They have no medical training, and they're just kind of going through and checking boxes and not paying attention to the fact that you are the expert and you know what your patient needs. I remember being on the phone with one such individual talking about a new patient that I had with autism. He was a junior in high school, really important year for him to get into college. He was highly functioning, what at the time we called Asperger's. And we knew what ADHD medication he needed. He'd been on it for years and knew that he was going to fail every single medication other than that one med that he needed. But his dad had switched jobs. He had new insurance. New insurance company said, we're not going to pay for that medication. You're going to have to go through every single med and fail it before we pay for this medication. And I knew what that was going to do to his grades, and it was going to make his junior year a disaster and affect the way that his ability to get into college. And so I remember arguing with them for hours, and they said, no, we're not going to pay for it. And slamming the phone down, and at that point saying, you know, people have been asking me to run for Congress. I'm going to do this. To run for the House at that point, sorry. And so every single patient that you have, you can find, most importantly, a story that you can turn into a bill and then use that story to propel the need for legislation, because that's really what sticks with people, right? As doctors, a lot of times we want a lot of statistics. We want to look for white papers. We want to talk about what different studies have been done around an issue. But what people and legislators in particular really remember is the story of that patient whose junior year is going to be affected, who might not get into the college of his choice, despite everything that he's done in his life, because his insurance company will not pay for his ADHD medication. And so that's what really has compelled a lot of my legislation.
Thank you. That is so important, just the power of stories and making these issues personal. I think that's really important, especially when we often show up to the Capitol in like our white coats. You know, it can come off a bit like stiff and
So you might think that it comes across as stiff, but seeing a sea of white coats or a sea of scrubs, people, like I have seen legislators who were like, I'm not going to vote for this bill. I'm against this. And then they see really a manifestation of this expertise in white coats or scrubs. And they take a step back and say, I'm going to listen to the experts, because these people are seeing patients every single day and they know more than I do.
Awesome. Okay, that's a really good perspective. Well, switching gears just a little bit, DEI in medicine has definitely been a controversial issue few weeks with the introduction of the Educate Act. EMRA and ACEP are both proud to support diversity, equity, and inclusion for medical students and residents. I know in our resident organization, we have a committee dedicated to creating policy and programming, supporting diverse trainees and inclusive training environments. And ACEP and EMRA are committed to supporting new initiatives directed at these issues. So as the first Latina physician in Congress, and along with Dr. Raul Ruiz, who's the first Latino physician in Congress, can you share a little about your perspective on the role of diversity-focused programming and processes in medical school and training?
Absolutely. You know, I think this is another manifestation of what has become a political point and a political talking point around DEI that has started with colleges, extended to K through 12, and now they're looking at medical school and residency programs to get rid of something that that really is just a talking point for them. It's not a talking point for me. I don't know that I would be a doctor without some of these policies, right? The fact that it had to be taken into account that as the daughter of a construction worker, maybe the schools that I went to were not as high quality as some of my classmates who had parents who were doctors and lawyers had been able to attend. And therefore I was given maybe a leg up in getting into medical school, but a leg up that was needed to be able to represent a community. There are only 2% of doctors in the United States. I didn't know this until I was in Congress and ran a Latino physician recognition. Only 2% of doctors in the United States are Latinas. And that was astounding to me. I knew that there were not many of us, but when you look at the percentage of the Latino population, which for example in Colorado is at around 20 to 25%, the people who look like me, who speak Spanish as their first language, who have immigrant roots like my family does, they can't find a physician who really truly represents them and who understands them. And so I remember being in northeastern suburbs of Denver and having people from all around the metro area come to see me in clinic because they had heard about this Latina physician who spoke Spanish, whose parents were Mexican. And so they knew that I was going to understand a lot of the cultural traditions that they had and a lot of the cultural beliefs that they had around health. It is incredibly important to have physicians that represent their community. I think we've done a lot around Black men, right? And making sure that they are able to get into medical school and represent their community because they're also very underrepresented in the physician community. And so this legislation is being run by people who don't understand the need for communities to be able to trust in their doctors, to be able to even just communicate basically with their doctors with the ability to speak other languages, and who are not taking into account the deep effects that this is going to have on community health simply because they want to go after DEI because it's a nice talking point to run on Fox News.
Thank you. I'm so glad that you did both have those opportunities and rise to the occasion and excel in the way that you did, because your story and your experiences and what you're doing, the bravery that you're showing by being a legislator in addition to being a physician, I think is really inspirational to a lot of residents out there and medical students. So I'm so grateful that you took the time to talk to us.
Thank you. It's always wonderful to talk to physicians, in particular people who are interested in legislation. And I really encourage you to get involved in advocacy and politics in some way, right? Whether it's writing to a legislator, calling them, showing up to testify in your white coat or your scrubs, or running for office. We really need our voices in advocacy and legislation, because healthcare legislation is being written and passed every single day in every state assembly across the country and in Congress. There's only 4 Democratic physicians in Congress, 15 Republican physicians, and that's out of 535 people, right? And the amount of money that we approve to go into all of the different programs that affect your ability to practice medicine every day is astounding. So we need to be part of the process. I know sometimes it feels icky to people to get involved in politics, but it's incredibly important because decisions are going to be made that affect our patients with or without us.
Absolutely. I couldn't agree more. Well, thank you so much, Dr. Caraveo. thank you, everyone, and for watching. And I hope everyone was able to enjoy some of the content that we've produced over the course of Advocacy Week. Hoping that we can also see you all at the Leadership and Advocacy Conference in Washington, D.C. that ASAP has put on. And that you all stay in touch and share this over social media so that we can get the word out about how to get physicians and medical students involved as early as possible in really creating a better healthcare system for tomorrow. So thanks.
Take care, everyone.